Hi, I'm Dr. Jonathan Clark, and I'm here today to talk to you about non-surgical spinal decompression. Non-surgical spinal decompression is an FDA-approved device that successfully treats herniated and bulged discs along with spinal stenosis and that chronic neck and chronic low back pain. The American Journal of Pain Management did some research and stated that 86% of these disc patients achieved good to excellent results with this procedure, along with their sciatica and back pain being relieved as well. So what exactly is going on when we say we have a herniated or a bulged disc? And in essence, what's happening is you've got your two vertebrae that sit here, okay, and in between the vertebra is this pad between the joints. And that's what provides this shock absorption. That's called the disc. So through an injury, that disc becomes displaced or bulges, and then when it sticks out further in the spinal canal, it'll actually affect the nerves that come out in between those areas. And we know when we're dealing with the low back, if it's a disc disorder in the low back, it's going to cause extreme pain in the low back, can cause immobility, numbness possibly into the leg, thigh, or even the toes. If it's in the neck, it's going to cause pain in the neck, along with possible numbness into the shoulder, arms, and hands and fingers, along with extreme pain as well. So this type of disorder is usually very uncomfortable for most patients and can cause a lot of different difficulties. So we utilize non-surgical spinal decompression, which is a computerized device that basically takes the pressure off the disc. So if you use your imagination with me for a second, and you think of a moon pie, and then you have a moon pie, you have the two pieces of bread, then you have the cream that's in the middle. If we compress the moon pie together, the cream comes out the side. Kind of what's going on with your disc when the two joints are compressed together. So what this machine does is basically takes those two pieces of bread, or the vertebra, distracts them, allows that discal material to come back in and be contained. It's not a steady hold traction like they had in the past. Again, this is a computerized device that we use that creates a negative pressure to allow that disc material to come back in and be contained. And we often use this on patients even after they've had unsuccessful surgeries and still can get some really great results with it. Does it hurt is usually the next question that I get, and that's really the best part of this, is most of our patients actually will fall asleep, get that cat nap while they're on the machine because it is so comfortable. So in addition to the non-surgical spinal decompression, we use a device that's called the ATM2. ATM2 stands for Active Therapeutic Movements, and what this helps us with is it helps us restore core muscle stability. So this is for that patient that every time they bend down to tie their shoes, they get the pain in their back, they can't do it. What's happened is the muscles that surround your spine are called your core muscles, and they're starting to break down and they're not working properly anymore. So when we utilize this device, we're able to get the pain away from those areas and have you be able to basically use those muscles properly again. It retrains the brain to recognize those core muscles. We can use this on a whole host of areas, anything from the neck, mid-back, and low back, obviously. We can also use this on shoulders and hips. And if any of you are golfers out there and you know the name Ernie Els, he's actually used this machine quite a few times and has given a lot of credit for that machine to help him return to his golf game so quickly from his injuries. So in our office, we have the latest technology in functional medicine to help you get better faster.